Good morning. A very good morning to all of you. Today, we are going to discuss the case note of Miss Patricia Stiles, who has suspected pericarditis relapse or complications of pericarditis, which she was treated for a week ago. So today, we go with the writing task. So what is said in the writing task is using the information in the case notes, write a letter of referral to the emergency department consultant on duty, outlining the case. So what we have to say is outlining the case and requesting urgent assessment and management for pericarditis. So this is what we have to do in the letter. We need to outline the case. So I need to give a brief information about the condition of Ms. Patricia Stiles, and I need to request the emergency consultant an urgent assessment and management of her conditions following her admission there in the emergency department. So this is what. So this is somewhere a letter which is written on an emergency basis. So we have to skip some of the data that's social history and something related to that. So let's go ahead with the condition once again. So we do have the name Miss Patricia Stiles. Now we have her age here and her address is there. So I have taken this thing, Miss Patricia Stiles, the age. So I don't want the social background here because it's an emergency letter, but I need the medical history, the history of hypertension, diabetes mellitus, and depression, because this is outlining the condition, and we do have certain medications too to include. We have medications quinapril, metformin, and glycoside. So we have lifestyle given. I don't recommend the lifestyle to be written in an emergency letter. So because it's an emergency letter, I just want the medical condition, not the lifestyle and social background. So secondary matter. So I categorize the primary things first. So the primary things is the present medical condition and the past medical condition. So we are focusing on those things, and we are not going into detail what about her lifestyle and her social background. So you may ask, it may become relevant. Okay, it may become relevant for a doctor which is who is consulting her in detail. Right now, for an emergency doctor, we need to include the medical details, the present medical details, and the significant past medical details. So this is what we are going to focus on. Now we have the treatment record, and we need to brief those treatment record. And it was on 23rd, the patient was admitted to Green Valley Hospital, and 24 she was diagnosed with a viral influenza type B pericarditis and pericarditis. So she had two problems when she was examined while she was admitted to the Green Valley Hospital. And the first thing was she had a viral infection, and the second thing that she had pericarditis. This was confirmed, and she was treated with brufen and IV saline. These were the medications which were given. So we can just say that she was treated conservatively. We didn't have any antiviral drugs or something like that. So after 2 days, 23, 24, 25th, she was discharged home for self-care at home, and she was advised to have a follow-up visit from a nurse. The nurse who is visiting her is you. That was on 30th. That is today. Today you are going to visit this particular patient, and now, during the visit, what you have observed is that you have not seen any significant recovery. As you have seen that the patient reported chest pain, the patient reported shortness of breath, and she reported fatigue. And you could see that her temperature, respiratory rate, heart rate, BP, all were elevated still. You could mark those things too to the doctor who is about to treat her on the emergency department. Okay, now we are suspecting either a relapse of the condition or the complications of pericarditis. This is what we have to inform the consultant. So what you are suspecting. Now you are reporting the matter to the consultant, so you have to say it is either relapse or complication. We are suspecting either a relapse or some complications of pericarditis. So this is the thing here. Organize urgent hospital transfer to Newtown Hospital. That's the nearest hospital. Write a letter to the emergency department. Include relevant medications. What we have to include: patient history, which we have test results and observations. So test results and observations, we have observations. We have a lot of things here: erythrocyte sedimentary rate, CRP, WCC. These are all the history which we have seen here in the case note. Let's go ahead with the case, with a model. Okay, this is today's date, that is 30th September 2019. It's clear. Yes, it's 2019. It's but you have the date. It's not September, it's August. So we do have to change. That's August, it's not September. So I have to say it's August. Okay, now emergency department consultant on new duty, Newtown Hospital, 100 Main Street, Newtown's address may be correct. I'm not cross-checking. Dear doctor, so you are addressing dear doctor because it's an emergency consultant. Reference Miss Patricia Stiles, aged 62. Thank you for accepting Miss Patricia Stiles, who requires, I don't need this comma there, who requires your emergency consultant and management. So thank you for accepting Miss Patricia Stiles, who requires your emergency consultant and management. She is suspected to have either relapse or complications of pericarditis. So we have briefly said what her condition is and what she requires. So the request is given first, requires your emergency consultation and management, and then the suspecting things, either relapse or complications of pericarditis. Now today, what happened today during the scheduled home visit, so we are highlighting the situation. So we are outlining. So you are going for a home visit, and during the scheduled home visit, it was scheduled. During the scheduled home visit, Miss Stiles did not appear to have recovered from her previous episode of pericarditis. From this, it is clear that she had a previous episode of pericarditis, and you are a person who were visiting her at her home. So the background is clear now. She reported chest pain while lying. Okay, so it was written, it is relieved by sitting up. So when lying down, it is worse. You have chest pain when lying down. When sitting up, it gets relieved. So you said while lying, she reported chest pain, shortness of breath, and fatigue. So this is what the presenting complaints, the complaints at present. Okay, on examination, so her investigations results. Well, the parameters are her current temperature, the pulse, respiratory rate, and BP. So we have written that the BP is lower than the usual, and the marking is also written. So this is what you observe right now, that is today, and this is her condition here. And last week, precisely on 23rd of month, so we have clearly said 23rd of this month, Miss Stiles was admitted to Green Valley Hospital with similar complaints and was treated conservatively for pericarditis and viral influenza type B infection. So she was admitted. She has a history of pericarditis. She has a history of viral influenza infection. So we have informed the consultant that she had some sorts of infection there. In a couple of days, she was discharged with an advice for self-care at home, followed by a follow-up home visit in 5 days. So we have said all the things are outlined. So we have not said in detail here. So outline in the sense we need to brief the things, brief the situation, because the emergency situation, in an emergency situation, I have to see the things outlined. So I need to highlight the main points in the minimum number of sentences, in the minimum number of words. So what the picture should be clear. At the same time, we need to reduce the sentence count or the word count. So I have I have reported that she was treated, she was admitted, she was treated, she was diagnosed with this thing, she was treated for that thing, and she got discharged for self-care, and a follow-up care was arranged in 5 days. Now, pertaining to her past medical history, her remote medical history, she has had hypertension, diabetes mellitus, and depression, and the years are given there, and has been on regular medications, including quinapril, metformin, and glucosamine. So the dosage is not mentioned. So we have just given the name of the medications. These are the medications which are continuing for the patient for hypertension, diabetes mellitus, and depression. So this is what we have said, and as we have outlined the condition, we have to make the request upon her arrival at your facility today. Today she is arriving, so we have to highlight that too there, because we have not written that in the introduction, in the purpose paragraph. We have included that here. Upon her arrival at your facility today, kindly confirm her current condition on an emergency basis and provide her the best treatment option. So, which you feel the most appropriate. Please do not hesitate to contact for any further queries regarding Ms. Stiles. Regarding Ms. Stiles. Yours faithfully, nurse. I just can go with nurse. I don't want home visit nurse. Yours faithfully. I don't need it to be capitalized. I just need yours faithfully, comma, nurse. Okay. So that is the end of the explanation. I think that I have given a brief introspection to this particular letter. Thank you all.